Right. Good evening, everyone. Thanks for tuning in. I'm Sarah Manzi from ProPlan. We're so excited to bring you a special panel discussion tonight on advances in whelping and postnatal care. We got the idea for this webinar from my own experience. I'm a second generation breeder. We have Portuguese water dogs and Lagotto Romagnolo. And I have learned everything from my mom, who has been breeding for 40 years. We're always interested in learning about, what the newest and better way to do things are, and we love finding those new tidbits to incorporate into our practice. They can make a huge difference, and so that's what we're hoping to bring to you tonight. Next slide, please. So who better to talk about all of this with us than Dr. Greer, veterinarian and breeder, and Miranda Payton, breeder and founder of the fabulous Canadian online shop that I spend way too much money at, the Breeder's Cupboard. Dr. Greer, would you mind telling us how long you've been breeding for and about your background?
Sure. So I have been in veterinary medicine. I graduated 43 years ago next month. I have had corgis for 35 years. I've raised two kids, corgis for 35 years, Danish Swedish farm dogs for 10. The old guy in the picture, I'm still married to him 42 years later. So so I've been around a bit.
On to you, Miranda.
I've been breeding Basset Hounds for over 15 years on our family farm out of Alberta. And I started the Breeder's Cupboard because there was nobody else selling or providing anything for breeders in Canada. So it started as a little hobby business out of my house, and it's grown to quite a busy shop. We ship all over Canada, and I'm excited to be here tonight and hoping that we all learn something.
Excellent. Thank you. All right, so we're going to break up tonight's discussion into 5 of the most challenging aspects of having a new litter. Whelping, fading puppies, managing the small puppy, safety in the whelping box, and then weaning. Plus, we're going to have a few minutes about what ProPlan and Breeder's Cupboard can offer breeders. We're aiming for about 1 to 1.5 hours, depending on how many questions we get. And then just a note that this presentation is intended for educational purposes, so please speak to your veterinarian about any concerns with your own dogs and puppies, especially when dealing with these types of challenging situations. Also note that the views expressed tonight are the reflection of the speaker's own opinion. Okay, so for Q&A, we have a little bit of Q&A housekeeping. We're a big group today, so everybody's going to be on mute during the presentation. But please do put your questions in the Q&A box as we go, because I will be jumping in today to ask Dr. Greer and Miranda your questions as we go. We won't be doing a general Q&A at the end. We do ask that you keep your questions to the topics covered today, as we will only be picking a few questions for each section. So we do apologize that we probably won't be able to get to everyone's question. So just take a moment to note the difference between the Q&A box and the chat box, as we'll be pulling the questions for our presenters from the Q&A box. But feel free to use the chat box to connect with each other during the presentation. And with that, I will turn it over to Dr. Greer to kick us off.
Good evening, everybody. I'm really glad to be here. It's always fun to speak to breeders that are really interested in these kinds of advances. So we're going to go through a couple of different topics tonight, and we're going to start off with the advances in whelping and the use of calcium and oxytocin to help accelerate the delivery of your puppies. And this is kind of an interesting topic because a lot of people talk about it. And I want to share some of the differences in the different kinds of calcium and some of my experience with you. The calcium supplement gel is the second fastest acting type of calcium that we have. It's the most available to breeders. The first and the fastest acting is going to be the injectable 10%, but that's not always easy to obtain. So I want to make sure that you all know how to use the gel itself. This is the Revival product. It's Oral Cal Plus. There are some other calcium gels on the market. This one is the most palatable. It's not as astringent in the mouth when you're giving it to the dogs, so they're a lot more accepting of it. And our recommendations to use this would be at the first sign of labor that you can start giving the calcium gel. We used to say you should probably wait until the female has had her first litter or her first puppy in the litter, but you can actually give it as soon as you start to see labor happening. Now, we never want to supplement calcium until she's at full term, because if we give it to her during the pregnancy, basically we tell our parathyroid gland, which is a gland in the neck next to the thyroid glands, that it can go on vacation. It doesn't need to really do any work, and it can just stop working. And so when she really has the demands of calcium for lactation and for whelping, she's not going to be able to mobilize that calcium out of her bones because her parathyroid gland is not going to be active enough. So we want to wait until we see the first signs of labor. And what we do see with this is we typically will see improved labor patterns, improved maternal skills, and it just seems to generally help quite a bit. Now, people want to give Tums. Tums doesn't work quickly enough. It's a tablet. It doesn't work as fast as the gel and the injectable. And of course, ice cream is a lovely way to get some fluid and some calories into her, some energy, but it's not going to give her the calcium that you want. So you may tell yourself every night when you scoop that bowl of ice cream for your bedtime snack that it's good for you because of the calcium. Really, there's not as much calcium in there as there needs to be. So the Oral Cal Plus gel works very quickly. It comes in this large tube, and it has a dial on it so that you can adjust how much you want to give so that you can control the amount that you're pushing. So the typical dose is going to be 1 to 2 cc's. For a large breed dog, probably 2. For a small breed dog, 1 cc. And then you want to give it at the start and then 1 dose per puppy. So as she delivers each puppy, you can squirt a little bit more in her mouth. Now, like I said, the tablets are effective for other things. They're great during lactation to keep the bitch from developing eclampsia. But for labor, we really want something that's going to act more quickly than we're going to get from the tablets. Like I said, the 10% calcium injectable is probably the fastest acting that you can give. It should be given only subcutaneously. You never want to give this intravenously. It has to be a product, calcium gluconate, labeled for sub-Q use. There is a 23% product on the market for dairy cows. That's given intravenously to a dairy cow. Number one, you don't want to give this intravenously because you can give it too quickly and actually cause the dog's heart to stop. So please don't do that. So if you are giving the calcium gluconate 10%, you can give it under the skin. If you give the 23%, we tend to see skin sloughs. It's like a chemical burn. And the dose on the 10% calcium gluconate that we use is 1 cc per 10 pounds of body weight. So a 60-pound dog would get 6 cc's. And I've also had people give the gel rectally. I'm not sure why, but it's not recommended. It, again, is not safe for that situation. Now, as you can see, this is a pretty palatable product. This is one of my Danish Swedish farm dogs. She scrounged this tube up out of the trash after we were done whelping. And this is the older label on the Oral Cal Plus. As you can see, we've updated the labeling at Revival. But she just wanted to demonstrate to you, and she actually did this out of the trash, was laying on my bed, chewing on the tube conveniently with the label facing you. It just would have been better if it had been a more current label. But we see calcium in addition to helping with whelping. We see that the bitches are less aggressive toward their puppies. They settle better, they lactate better, they're less aggressive toward people, especially strangers, and they're less likely to develop eclampsia. And eclampsia is when the calcium levels drop too low, typically in small breed bitches with large litters, and they develop a low calcium and a seizure type of activity. So by using the tablets during lactation, you're going to prevent that. By using the gel during whelping, you're going to keep the labor patterns moving along quickly. Oxytocin is our next topic, and it can be pretty difficult to get a hold of oxytocin in most places for a good reason. Veterinarians are reluctant to share it with their clients because of the risk that's associated with using too much of it or using it too aggressively. We never recommend using it before the first puppy is born. We always recommend really small doses. The doses that used to be or are still on the label of this product, they're much too large for small dogs, so we don't recommend it at that level. It's available for dairy cows, which is great because it's labeled for dairy cows, but it's not labeled for safe use in dogs and cats at this kind of level. So this is typically only given by a veterinarian or under a veterinarian specific instruction. And the TB box of syringes is on here to remind us that the doses have to be itty bitty micro doses. Whelpwise, the company that provides us with whelping contraction services here in the US, and I don't know if you can get it in Canada or not, they have proven that the itty bitty tiny little microdoses are actually more effective than larger doses in creating good rhythmic systemic contractions of the uterus so that it effectively expels the puppy. If you give too much, too fast, too frequently, you can shrink up the puppy's uterus, basically clamps down on the puppies, and in severe cases, you can cause uterine rupture, and that's very dangerous.
Hi guys. I thought I would highlight a few of the new products that we have at the Breeders' Cupboard. We have the nursemaid wipes. They're fantastic for cleaning up mum. My bassets, they drag on the ground. Their memories are always kind of low. And so I went through a couple of these each litter. They're nice and safe for puppies. There's no taste. And I find that they're pretty tough. So you can get a fair bit of wiping of pups and mum with them. Dr. Greer's already spoken to you about Oral Cal Plus. It's fantastic. It's vanilla flavored. The dogs love it, as her photo showed. And it's a lot better than Tums. I think there's 200 mils of calcium per mil of Oral Cal. So, you're getting a lot of calcium for a small amount into mum. The other product that we highly recommend everybody has is a Dealy suction. If you've never seen these, they're pretty neat. You just suck on the one end and it's got this lovely little small French tube that you can stick back into puppy's throat, and you give it a good suck and it goes into not into your mouth, but it goes into the little mucus trap. I think everybody should have one of those. Another product that's brand new from Revival is the Breeder's Edge Clean Cut Iodine. And what I really love about this product is each bottle is just a small amount designed for 1 litter. The opening is perfect to fit around your cord. So I just, on the puppy, and flip them over. And then after the first couple days and the cords dry out, you can just throw it away and start with another one from another, or for your next litter. And I never used to dip my cords until I sat through one of Dr. Greer's seminars, and she spoke about how important it was to keep your umbilical cords really clean and dried out to prevent sepsis. So if you don't dip your cords, I recommend you start to avoid fading puppy and whatnot. And then I put our oxygen concentrator on there. If you've never seen these, they are oxygen therapy at home with just distilled water. So you can use them for the incubator. You can use them to give your puppies a little bit of oxygen when they're born, help pink them up. And they're fairly affordable. They're around $400. I know a lot of breeders buy them and share them. Everybody kind of has oxygen on hand. They're great. Yeah.
So many people you're using the Oral Cal Plus. So kind of with that, Dr. Greer, I have a question for you. There's a gel and there is the powder. So what is the difference between the two?
Again, how quickly it works. The powder and the tablets are pretty comparable. They are great for lactation, but they're not going to get you through a whelping. So during whelping, you really want to have the gel available, and they do have that at Breeders' Cupboard. So make sure you order that ahead of time because you need it when you need it, and you don't have time to get it. There's no same-day delivery, so get it in advance. You're going to regret not having it if things don't go the way you want them to.
All right, so let's jump into our questions. So are there any studies on the use of calcium for maternal behavior post-whelp, restless, digging, nesting, etc.?
The only study I'm aware of was done in the mini bull terrier, and they do have some pretty good documentation that does improve maternal skills, cuts down on some of that agitation. So some of those activities, we don't have that study in any other breed, but anecdotally, we see a lot of really good responses. If you have a bitch that sort of, gets agitated if somebody walks into the room that she doesn't know, or even sometimes they do, if they don't seem to lay down and settle really comfortably for the puppies, a lot of those things are calcium related. And that's, again, where the gel is going to give you that faster effect. Once they're a week into lactation, powder, tablets, those are great. But that really need for immediate activity is what you want to use the gel for.
Okay, so that kind of gets into, there's 2 questions here that I guess are kind of related. Do you give the oral calcium post-whelp, and how long do you suggest calcium to lactating females?
Yes, you can give it post-whelp until you've got her well settled in and taking care of the puppies. Calcium, especially for a small breed dog with a large litter, say you've got a 10-pound dog and 7 puppies, you want to keep her on calcium until those puppies are weaned. The larger breed dogs, Labradors, Goldens, the large breed dogs typically don't develop eclampsia. They have enough bone mass to really compensate for the amount of calcium that they need mobilize from the bones to get into the milk. But the small breed dogs, the dachshunds, the terriers, the little guys, my farm dogs, when I've had a litter of 6 or 7 puppies, I make sure that the bitch is on the calcium, either the tablets or the powder, whatever you prefer. They both taste really good. I've tried them both. I tried the paste, like Miranda said, it's vanilla flavored. It's tasty. I don't recommend that you take it personally, but I'm that person that tastes anything I'm going to put in my dog. I'm going to taste it and see how it is before I administer it. So it's very well tolerated.
Okay, so we had a follow-up about asking about possibly getting the link on the study in mini bowls.
I'll have to look for that. I don't have it at my fingertips.
Okay, and then we have one, so just to clarify, we give the initial dose when mother shows signs of labor, i.e. restlessness, shivering. Can we use a suction bulb that comes in the kit to clear the secretion for puppies?
Sure.
So I guess she wanted to follow up on when to give that initial dose.
Yeah, as soon as you start to see evidence of labor is fine. She starts nesting, digging, any of those things, it's fine to go ahead and give it.
Okay. We had a question about nasal oxytocin being available.
Mm-hmm. Yeah, I don't know what you have in Canada. We can get it on Amazon here in the US. And there are some studies or some anecdotal reports that it seems to help, again, settle the females. I don't think there's anything that shows that it helps with labor patterns, but it does seem to improve their psychological ability to become good moms.
Okay, and then the last question for this section, will the clean cut help reduce risk of umbilical hernias?
Probably not, because those are genetic, but this does reduce the risk of the infection that can ascend up the cord. And if you're having sudden death in your puppies that are very young, up to probably 5 to 7 days old, and you don't have a good explanation for how they became septic or sick and suddenly died, I'd be dipping cords. I've lost my own one puppy when I was dipping the cord in chlorhexidine. That was back in the day. The chlorhexidine was the recommendation, and it's now swung back to the tincture of iodine, which is what we have in the clean cut. Tincture of iodine is iodine and alcohol mixed together. So it sterilizes the cord, it dries it up. And like Miranda said, it's meant to be a 1-liter use bottle. So when you get done with it, you're meant to throw it away because you don't want to have anything growing in the bottle before the next litter is using it. So just discard it. I know people are like, oh, but it's too much to throw away. No, toss it. It's meant to be one use. It's not expensive.
I think the great thing about those is one of those earlier webinars you did for us, I remember, and we've been dipping our cords ever since, and they certainly fall off faster.
I was just going to say that my cords, they fell off so much quicker now that I'm dipping.
All right, so we're going to jump into the next topic.
So next we're going to talk about our fading puppies. And fading puppies is unfortunately a category that we see people just kind of dumping everything into when they can't figure out what's wrong with a puppy that gets sick. The basic symptoms are any sick puppy, and it can be very, very difficult to sort out exactly what you have here, but it's typically a puppy that's failing to gain weight. It may be restless and crying excessively or excessively quiet. It may have a low body temperature. It may just generally seem weak. You know how when you pick up a puppy and you've gotten used to how those puppies' body tone should feel when they're a day or two old. They feel solid. They feel, strong. You get a feel for it, and when they're weak or limp or just they're just not right, then take their temperature, do some things, but you need to figure out what's going on with these guys, because fading puppy is not a diagnosis. It's just a garbage can of what happens that we categorize puppies into something that we just don't know what to do with. So, what can we do when we have a puppy that we're not completely sure what to do? I'm going to show you some things that you can measure. You can, of course, measure body weight. That's easy to do. You can measure body temperature with the rectal thermometer. You can check urine color. And so those things are all really important for us to assess, because when we have a puppy that's not doing well, we can have a puppy that's low on oxygen. They're not breathing very effectively. If they're hypoxic, then they're going to become chilled. If they're chilled, then they're going to become dehydrated because they're not eating and able to absorb their food. And then their blood glucose drops. And then the whole cycle just becomes more and more significant. So it just becomes this vicious cycle. And when this is happening, we're going to lose puppies because they just simply cannot thrive when they have this kind of situation. So we want to be sure that we're taking care of them. So like I said, it's not a diagnosis, but the things that we need to do to support them will be to keep them warm and dry, to make sure they get oxygen. And we've talked about the oxygen concentrator. So if you don't currently have an incubator and an oxygen concentrator, those are very important for you to have to help save these puppies. Then we need to make sure that they're getting well fed so that they have enough calories and they're well hydrated enough. And then we want to monitor their stool and their urine character. If they have diarrhea, they're not going to thrive. If they're dehydrated, their urine is going to be a dark yellow color. So those are things that you want to do. So keeping them warm can be things like putting them in an incubator or a heated whelping nest. So we want to make sure that they stay warm enough, but not too warm. And we're going to go through some of those temperatures here in a little bit. There's a number of different incubators on the market. This is one that they carry at Breeders' Cupboard. When I've raised my own litters, this is a litter of 10 Corgi puppies that very effectively were raised on the old T.E. Scott whelping nest. Now they have other companies that make them. There's some that are heat sources that are not electricity. If you don't have electricity, you can use other power sources. But these are a really great way to keep puppies warm and to keep them at an appropriate temperature because you can control the temperature. Of course, we want to keep them nice and dry. At our practice, when puppies are born by C-section, they go directly into a colored towel, which is why these towels are laid out here, is we put them in a colored towel so we can keep track of our resuscitation techniques, where they were in the litter, in the uterus, what kind of support that they needed, what they weighed, all those things. So when our puppies leave our practice from our C-section, we can give this information to our clients. The incubator, of course, is absolutely essential that you have a nice warm place for these puppies to go so that they're safe. And then the oxygen concentrator, basically what an oxygen concentrator does is it takes room air, which is 20% oxygen, and it concentrates it and emits it as 95% oxygen. So you can very effectively provide a higher level of oxygen for your puppies without having to worry about an oxygen tank that runs out because the welding shop that you got the tank from is not open at 2 o'clock in the morning, and you know that's when you're going to run out of oxygen. So as long as you have electricity, the oxygen concentrator can provide an oxygen-rich environment. I've had clients that have started using the incubator and the oxygen concentrator, and they're like, you put these puppies in there, they get oxygen, they get warm, they get dry. They sit there like zooming around like they're on a little racetrack. So it makes a huge difference in the viability of these newborns because those first few hours are absolutely critical that you get them off to a good start. If they're not warm, if they're not oxygenated, they're not nursing, and if they're not nursing, you're already losing ground. Feeding, of course, is absolutely essential for these guys. Now, if they get enough by nursing, great, more power to you. But if you have a puppy that's weak, that's small, if you have a large litter that just doesn't have enough nipples and enough milk to go around, then we need to figure out some additional ways that we can support these puppies. If they're strong enough to take a bottle, great, use a bottle or one of these syringes with the nipples on it. Ken Sundin at Puppy Warmer is now making these silicone nipples. He's got two sizes here in the photograph, a medium and a large. And he does make these out of food grade silicone. So it's important that you know that that's the source of your silicone. Some of the other nipples on the market are not food grade. So we have to be a little concerned about that. If you have a puppy or puppies that are too weak to effectively either nurse on mom or take a bottle, then we want to make sure that you know how to tube feed your puppies. So we're going to go through how to do that. But remember that there is a video in the Revival Animal Health Learning Center. If you click on the little blue graduation cap on their website, and then you go to the Learning Center, that'll take you there, and then you type in how to tube feed a puppy. There's video on there that I did, so I know it's correctly done. So it's available to you 24 hours a day, anytime you need it. We'll go through that in a few minutes. Fluids are important for hydration. If you have a puppy that's not well hydrated, you can give the fluids subcutaneously under the skin. You can give them orally with a feeding tube or with a bottle. And anytime the gut is working, if the puppy's not vomiting and the puppy can take a bottle, or you can get tube feeding down, orally is always the preferred method of giving fluids. If you can't do that, then giving the fluids under the skin are great. If you have a puppy that needs to be on IV fluids and it's big enough for an IV catheter to be put in, again, great. Go ahead and have your veterinarian do IV fluids. If you need to do something at home, a butterfly needle is a very handy way to do this. It's a needle with a little wing set on it. So it's a lot easier for you to manage that needle under the skin of a little bitty puppy that tends to be squirming around a little bit. The dose for a puppy would be 1 cc per 30 grams of body weight or 1 ounce of body weight for those of us in the US, plus whatever they've lost for diarrhea. So if they've lost 30 cc's of fluid, you need to give 30 cc's more than the calculated amount. Our recommendation is to give normal saline to our very young puppies. Lactated weaners is better than nothing, but they actually can't metabolize lactate. That adjusts their pH. So you're better off with normal saline in the really young puppies. 5% dextrose is a great product, but if you give it subcutaneously, you run the risk of abscesses. So we don't recommend that. And at one point, there were some things published about giving fluids intraperitoneally into the belly. That is no longer the recommendation. Stool character, of course, is very important that you monitor. Anytime we see puppies with diarrhea, we have to be concerned. So the normal stool should be soft, yellow, and seedy. If you see diarrhea, if it's white, if it's green, if it's too yellow, if it's not that right character, then you need to be concerned. Now, this is a little bit beyond what the very newborn puppy will have, which is parvo. We typically see that between 6 and 12 weeks of age in puppies that either haven't been vaccinated yet or have had a vaccination failure. But I want you to be aware that Elanco in the United States has come out with a new product. It's a monoclonal A antibody. The product was developed by Kindred Bio here in the US and then purchased by Elanco. If you're interested in knowing more about that, you can go to the link. If you just Google search Elanco monoclonal A antibody for parvovirus, it'll bring up this information. So it is available. It has to be kept frozen. It has to be given intravenously. So at this point, we're only going to see it coming from veterinarians and potentially always that way. It'll depend on how the product is evolving once it's off conditional use. And I just found this last night when I was preparing for this presentation that Elanco now on their website has this information on how to report and track parvo based on where you live. I tried to figure out if you could use it in Canada, and I really couldn't tell. It does have Canada on the map, obviously, but I'm not sure if they're tracking by zip code in Canada or not. But the little legend down at the bottom shows you the incidence. And so if you live in an area that you're concerned about a parvo outbreak, you can track what's going on in your zip code in your neighborhood, or you can report cases if you're involved with any of that kind of information. Urine color is a really great way for us to assess if the puppy is getting enough hydration. And it's very simple to do. You just need a white tissue, a white paper towel, a white cotton ball, some way that you can collect the urine by rubbing the perineum of the puppy. And if the urine is a dark color of yellow, the puppy is dehydrated. The puppy should have very pale colored yellow urine. I know there's some people that don't feel that this is very useful or very accurate, but in my experience, it's very useful. I can walk into the exam room with a litter of puppies. My staff has already gone through, weighed them, temped them, checked their urine color, and they can already tell me which puppies are dehydrated based on the urine color. So it's simple to do, and it's a very useful tool. So it's something to keep in mind for if you're not quite sure if you need to supplement your puppy. If the puppy's not gaining weight, and we used to say a puppy could lose up to 10% of its body weight and be okay. But from NeoCare's information, we know if they lose more than 4%, they're in trouble. And if their urine is a dark yellow color, they're in trouble. So what do we do about that?
So I highlighted a few products that I recommend to our customers when they have puppies that aren't doing as well or to avoid getting to that point. The first one is NutriDrops. These are a really neat product because they don't require digestion. So when my puppies are born, they get a drop in their mouth after we clear airways and whatnot before we let them nurse. I find it just makes them nurse way more vigorously. If you have diarrhea, I just gave them to my mom who had diarrhea after her litter. The one thing I can say about this product is it is not palatable. They do not like the taste at all. So that is something to be mindful of, but it is great. And when you need to use it, it's there for you. And Sarah has just said that it's one of her favorite products.
Yeah, we've been using it for years and years. A toy breeder told us about them. And I would say if I had to have one thing on hand for whelping, it would be the NutriDrops, because a puppy that is, smaller or was stuck in the birth canal and got, was a little wet, I just find it gives them a jump start. So we used to give it just as a if the puppy was weak, they would get a drop. And we've gone straight to now, they get a drop on their mouth. As soon as their airways are clear, they get a drop of the NutriDrops, they get a drop of the Nurture Mate, and they go in the incubator. And I just find that our puppies come out so much more vigorous for nursing with that. I think it's just such a great product. I think everybody should have NutriDrops on hand.
Yeah, they're in our Welping kit as well. I totally agree with that. And why wait until they are weak, right? Why not give them that good start? Another one that I swear by is the Dogzymes Puppy Support. It's a prebiotic, probiotic, colostrum, glucose, electrolytes, and vitamins all in one. I give this to our puppies when they're not doing as well. The small guys, especially if I'm supplementing, I'll give them a little bit before I give them their milk replacer. And if they're not doing well, you've got a puppy that's just really, fading, you can give it every time you feed for that first 24 hours. And most of the time, if you've gotten to the core of what's going on, it will really help them come back around. Dr. Greer also mentioned the saline. We get asked all the time if we should use lactated or saline. And for the little guys, saline is definitely best. We sell the bags of it with some butterfly infusion. So it's great to get that little guy that's really dehydrated back around if you can't do it with oral fluids. We wanted to bring in an incubator that was affordable. So we do have, the Cadillac incubator, but not everybody wants to have that kind of investment on hand. These incubators are really lightweight. They're affordable. They're $200. You can hook them up to your concentrator if you want. They've got a couple heat sources. They come with a little thermometer to keep your humidity and your temperature control. I just brought my puppies home from their C-section in that the other day. I loved that I just plugged it into the back of my car on the converter and kept them warm. So, and they fold down flat. You can set them up in about 5 minutes. So definitely something to consider having on hand for any breeder. And then the Nurture Mate is, you give it in the first 24 hours, ideally the first 12. And it's great. It's colostrum base, and it really makes a difference in the puppies long-term, how they thrive, in my opinion.
So let's jump into some of the great questions on here. Dr. Greer, can you recommend a good glucometer for puppies?
Yes, a glucometer. The one that is made for veterinary medicine that we have in the US, and I'm assuming that you can get it on Amazon, is called Pet Test, PETTEST. It's small. It runs under $50. It includes the strips. And then you can very easily poke the bottom of a puppy's foot pad and obtain a blood sample on that Pet Test strip that can allow you to monitor the puppy's glucose.
Okay. And then what would be the best thermometer to use for a newborn puppy?
Any rectal thermometer that's digital that quickly reads is fine. The smaller the diameter, the easier they are to get in those small puppies. Mela is a company here in the US that has come out with a thermometer that's used in the armpit of the dog. They're still getting that calibration based on the size of the dog, the age of the dog, the breed of the dog, the coat, that kind of thing. So for now, I would continue using the rectal thermometer, but keep an eye out for Mela, because that's going to be interesting. It was on Shark Tank in March of this year, so there's some information out there about that thermometer.
I was just watching something online about their Shark Tank, and it looked so interesting.
Mm-hmm.
So I'm hoping that's something that comes to Miranda soon, so I can spend some more money.
To them. Yesterday I was speaking to them, so keep an eye out for that. I think that we'll be able to add those to the store.
Excellent. So Miranda, what is the shelf life of the NutriDrops?
It's about 2 years.
Okay. Thoughts on liver water for feeding puppies?
I don't use it. I think other people have success with it, but it's not been a product or an item that I've tried using at my house. I prefer using some of the commercially available products.
Okay.
I have used it. Sorry.
Okay. And then what about using 0.9 sodium chloride for hydration?
Yeah, that's what the saline is that she has here on the screen. That's 0.9% saline, which is an isotonic saline. That's exactly what you should be using.
Perfect. Okay, so for the puppy support, do you feed that in place of formula, or in conjunction with formula?
No, it is not a milk replacer at all. It is in conjunction with a supplementation or nursing.
Okay, so is it one I've never used that one. Do you just add it in? Like if you're formula feeding, do you mix it in with the formula or is it a separate feeding?
I mix it up on its own. You can leave it in the fridge for 24 hours. So mix up a little bit and then just give them the recommended dosing. And if I'm tube feeding, I'll do the puppy support and then the formula. If I'm syringe nipple feeding, I'll give them that. But you could mix it in if you want to.
Okay, and then I forgot one. Did you see shelf life for puppy back and puppy support as well?
It's usually about 2 years from manufacturing. The dates are on the containers. And if you're ever concerned about dates, you can always give us a quick call or email and we'll check what we have on the shelf for you.
Perfect. All right, back over to you, Dr. Greer.
Great. So our little puppies, our small puppies are somewhat different than our fading puppies. These are puppies that aren't in trouble. They're not already fading, but they are puppies that may be small birth weight puppies. SGA is small for gestational age puppies. So we'll talk about those smaller puppies and our ability to monitor weight gain. So our small for gestational age puppies do have an increased risk. According to Neocare, which is at the vet school in Toulouse, France, the south of France, low birth weight puppies have an 81% chance of death in the first 48 hours. And that's pretty mind-blowing. Like, we need to really work on these little guys. And if they are in the smallest 25% of their breed, they have an increased risk of mortality in the first 48 hours. So it's really important that we're keeping an eye on these guys. And I've had plenty of clients that have very successfully been able to raise their little tiny 2-ounce and 3-ounce puppies in spite of the odds, because they have been well educated and they're willing to work those extra hours that it takes to keep these little kids alive. We also used to say that puppies could lose up to 10% of their body weight in the first few days and they would be okay. But Neocare has told us that if they lose more than 40% of their body weight, that they have an 8-fold increased risk of death. So these are all really sombering statistics, things not meant to scare you, but to give you the ammunition and the willingness to jump in and help these kids out when they're in trouble. Like I said, we used to say 10% was okay, but we know it's not anymore. And if you look at Neocare's data, they can show us that of the puppies that we lose, they're typically going to be the puppies that were small birth weight puppies and that did not gain weight, that lost more than 4% of their body weight. So that's very sombering. And then if they do survive, if we do get them enough supportive care with our nutritional support, with feeding, tube feeding, bottle feeding, adding these additional products that Miranda has talked about, we can see that our low birth weight puppies can catch up and can survive nicely. So how do we weigh these guys? What do we do with our SGA puppies? Well, of course, a digital scale is a really useful tool. The ones that toggle back and forth between ounces and grams are really effective. A lot of people in the US think in ounces. So that's a pretty useful way for us to keep track. And once our puppies get a little bit bigger, that they're difficult to keep on a scale, then we can go to using a fish scale. And I don't mean the scales on a fish. I mean a fish scale, like you go out to the boat and you bring in the scale and you go to Walmart and you get a little mesh bag with a zipper on it. And you can put these little kids in the mesh bag and pick them up and weigh them effectively. So instead of having them flip-flopping around on the scale, you can really get an accurate weight on these guys. So why do we have small for gestational age puppies, SGA puppies? And the answer is, it's not that they're premature. Now, if the whole litter is premature, that's a different conversation. But a lot of people think that if they have 1 or 2 small puppies, that it's because they were premature, that they weren't conceived at the same time as the rest of the litter. And the answer to that is that's not really accurate. It's usually about the piece of real estate that they had. So if their placenta was crowded because it was a large litter, or they were crowded up against another puppy, or it was just an unhealthy part of the uterus, they don't have the blood flow to give them the good nutritional support they need before they're born. So we have like this little tree that's living here on the rocks where they've got 4 little granules of dirt, or this house that's about to wash away. It's all about the real estate. So if we don't have a good, healthy uterine attachment for the placenta, we're going to have smaller puppies. So what are you going to do? Well, here's an example of one of my friends with corgis. She had 2 corgi litters born the same day, in the same household, fed the same food, all the same things that happened, but you can see the litter of 4, and this is in the incubator from Puppy Warmer. You can see of the 4 puppies, that the 4 in this litter are these big, robust puppies. And when you look at these other 7, they're itty bitty. They had a much different uterine environment because of the crowding. So what we need to do with these guys is make sure that they get enough nutrition. Now, colostrum is also absolutely essential. In human babies, they only get 10% of their antibodies from their mother's milk. They get 90% through the placenta. Dogs are the reverse. 90% of the dog's antibodies, the nutritional support that they get from their colostrum is where their antibodies come from. So it's absolutely essential that our puppies in the first 12 to 24 hours get plenty of colostrum. We know that the colostrum is only produced for 12 to 24 hours, and we know that the lining of the intestine changes at 24 hours so that those big molecules called antibodies cannot get through after the first 12 to 24 hours because the intestinal tract wall changes, and so those big molecules can't get through. So if they don't get colostrum early on, they're going to be colostrum deprived, and that's going to mean that they're increased risk of picking up the kind of infections, bacterial and viral infections, that they would be protected against from their mother's colostrum. So we really have to make sure that they get their colostrum when they're young. There is a correlation between early growth rate and colostrum ingestion. Again, this is NeoCare's information. And if we're going to supplement feed our puppies, we need to make sure that their rectal temperature is high enough, that they are warm enough that they can digest their food. If they're chilled, their intestinal tract doesn't effectively move. They can't digest their food. The food sits in their stomach, it foams up, and then they aspirate. And so we have this very difficult situation. So it's very important that we're taking their rectal temperature and making sure that they're warm enough before we feed them. This is the mellothermometer that Miranda's talking about, that she's working on getting. It's not yet available, but it probably will be soon. So what do we need to know about our puppy's temperature? And that's that in their first birth week. And if you want to take over here, Miranda, talk about this.
There we go. I did this chart up to have on hand for you guys because their body temperature increases as they get older. So the first week, they're at that 35.5 to 36.6. And then as they get a little bit older, it increases, and they can't, as most of us know, they can't regulate their own body temperature for that first couple of weeks. And definitely, I did not know for many years not to feed my puppies when they were chilled. So you'd see a chilled puppy, off on their own, and you'd grab them up and think, I got to feed this puppy, and feed a chilled puppy. And that is a very sad mistake to make. So it's good for everybody to know. Definitely take their temperature before you're feeding them.
So for bottle feeding and they're strong enough to suckle, that's great. Like I said, we have the puppy warmer nipples, which are soon going to be in production. So those will be available in larger quantities pretty soon. And then Miranda, this product is one that you carry?
Oh, that's Karen Kuzik. Gets these made in the UK, and they're the amazing puppy, the amazing nipple, nursing nipple. And she says the most universal is the small long tip. We've had really great success, and they are made out of food grade silicone as well. So
if you have a puppy that'll take a bottle, great. If you have a puppy that'll nurse, even better. But if we have a puppy that's not doing well and we need to supplement feed, then we need to start giving them some additional support. And I know a lot of people are really nervous about tube feeding because they've just never been comfortable with it. And I'll tell you that more puppies are going to be lost to starvation out of fear than there will be from a tube feeding accident. Can tube feeding accidents happen even when you take all the precautions? The answer to that is unfortunately yes. But you're much more likely to lose a puppy to starvation than you are to lose a puppy from an accident. So the 5 Ps of tube feeding are going to be pre-measure the tube. So you need to measure the tube from the tip of the puppy's nose to the last rib. And that will make sure that you're in the esophagus and not in the trachea. The esophagus is longer than the trachea. The trachea divides at the shoulder. So if you're all the way down to the last rib, you're safe. Number 2 is, as we've said, you want to make sure the puppy and the formula are warm. So you want to take the puppy's temperature rectally. For the formula, I just use my wrist. I know people Sometimes I'll use a thermometer in the formula. I'm old school. I fed my babies this way. Just put it on your wrist and make sure it's not too hot, not too cold. When you pass the tube, you want to pass with the puppy's chin down and pass to the left side. A lot of people tend to want to tip the puppy's head up and look where the tube is going. And that's actually a dangerous thing to do. You want to keep the puppy's chin down because that will keep their airway closed and you're more likely to get into the esophagus than the trachea doing that. The left side is where the esophagus is. The right side is where the trachea is. So pass to the left. And the most important thing is before you feed the puppy to pinch them, pinch their tail, pinch their toes, pinch something that'll make them squeak a little bit. Now you don't have to make them scream, just enough that you can hear, because if you're in the esophagus, the puppy can cry. If you're in the trachea, the puppy cannot cry. So you should be able to hear at least a little bit of a squeak before you feed the puppy to assure you're in the right place. The amount we feed is 1 cc per 1 ounce of body weight. And like I said, I've written this for the US. So 1 ounce is 30 grams. So it's 1 cc per 30 grams of body weight. I don't want complicated math at 2 o'clock in the morning. You don't need to sit down with a calculator and try and figure out the caloric intake. This is based on stomach capacity. So if you have a 4-ounce puppy or 120-gram puppy, you give 4 cc's. If you have a puppy twice that size, you give 8 cc's to our 240-gram puppy, and you want to do that every 3 to 4 hours. So this is a really great formula to keep in mind. Like I said, because complicated math doesn't happen easily at 2 in the morning. So this is a little Rottweiler puppy that came to us. He and his brother were born at home. And he was not thriving. He was not gaining the way his brother was. So the client gave me a call and was concerned about it. So we had her come in, and this is just a nice little video. You can see his chin is down. You can see I'm passing to the left. And I'm going to take my left hand and hold the tube between my index finger and my third finger, and then slowly put pressure on the plunger. Of course, I've already got a mark on there because I had passed it. And then I pulled the tube because I know how to tube feed a puppy, and this client needed to take this puppy home with her. So if you need to see this video again, you can go to the Revivals Learning Center. You can click on the video, and I will be there at 2 o'clock in the morning to virtually hold your hand to get you through this. So once you've got the tube in, you want to just very slowly put pressure on the plunger and feed this little guy so that you can effectively get the amount of formula into him that he needs to continue growing. So it's very important that we give him this very slow amount of feeding. You can hear him squawking a little bit there, so you know that you're in the right place. She's holding the tube. She's a little nervous because this is her first time tube feeding. So I made her do this so that she was able to go home with this little kid and feed him. So many of my clients that come from a distance away. This is one of my friends from Iowa, and I wouldn't let her leave until she knew how to tube feed her puppies. So she's very excited because she has her new litter of puppies and she knows what to do with them when she gets home. And this is that little Rottweiler puppy that you saw in the earlier video. And I'm going to ask you if you can tell which one is which, if you can tell which was the little brother and which was the big brother. And I'm going to say you probably can't. And for the people that say, well, I'm not going to bother to feed that puppy, it's not meant to be. He's obviously got something wrong with him. I'm just going to let him die. I'm going to tell you that it's not really fair to do that because this is the little puppy we were tube feeding. This is at his 9-month-old show, best puppy in show at the Fond du Lac Fair, which is our local fair. So please don't throw the rump puppy away. They need every chance. And if all they do is just got off to a bad start, you need to warm them and feed them. I think that's a very fair thing to do.
I think this is a great time to jump in with our next poll question. So it's going to be here. How comfortable are you with tube feeding puppies? I know I'll say with this one, we had a litter. They'll be 2 years old in May. Our whole house, mom had no milk. There was 11 puppies in the litter. Our whole house had the norovirus, or the vomiting bug, as they call it. And there was a need to tube feed, and I was feeling very ill, but I've watched your video probably 1,000 times, and I knew that that's what those puppies needed. And I will have to say that I think that's when I became an expert tube feeding. So we've got quite the variety of answers here from haven't tried, comfortable, expert. All right, back to you, Dr. Greer.
Right. And when you do have a litter like that to feed, you can bottle feed them and spend an hour bottle feeding the whole litter, or you can get out of bed tube feed everybody, get back into bed in 10 minutes, and get a nearly full night's sleep. So when you've got a situation where you're sick, where you've got a lot of puppies, you've got to work, you've got all these other complicating factors, feeding is a far more effective and efficient way to make sure that the calories are down them. Now, that being said, they'll probably take more volume with a bottle because their stomach expands as they're suckling. But when push comes to shove, and if you've got it at least just tube feed maybe once during the night, and during the day you have the time, or the bitch has the opportunity to feed them, great. But if you need to get food into these guys, it's the most efficient way you can do it. Of course, you want to keep track of your puppies. You want to do AM and PM weights, AM and PM rectal temperatures, AM and PM urine color, and then you want to keep track of your early neurological stimulation and your other notes. So just keeping track on a piece of notebook paper is great. If you want to be fancy and you want to use an Excel spreadsheet, more power to you. You can see trends either way, but this is a way to keep track of your puppies. So our keys to success are going to be to identify our puppies by color so that we know who is who, so we can keep track. A lot of puppies don't have markings, so it can be hard to tell one golden retriever from another. So markings, collars, any of those things are useful. Make sure they get colostrum. Make sure you rotate the puppies. If you've got some puppies that are small, the back nipples are the ones that have the most effective amount of milk. So if you have a little kid, put them on the back nipples. Sometimes you'll have puppies that are bullies and they'll want to keep taking that big nipple, that big producing gland, and hog it for themselves. So the bigger puppies need to be kind of pushed to the front so the little guys can get a chance at the back. And then make sure if they haven't gotten colostrum that we're providing them with plasma. So, Miranda.
Thank you, Dr. Greer. We just spoke about tube feeding. We sell feeding tubes at the Breeders' Cupboard. Everybody should have one on hand, guys. Don't call me at 5 o'clock on a Friday and ask me to get you tubes on a Saturday, because I can't. So just order one ahead of time, then you've got them. And then we've got the Breeders' Edge Foster Care. It's a great milk replacer. What I like about it for these little guys is it's a 46% fat, which is, to my knowledge, the highest fat content on the market. So you're really packing those calories to these little guys. It's great for it's very well received for their GI tract as well. Then we've got the puppy warmer silicone syringe nipples. Those are coming. I'm really excited about them. As Dr. Greer mentioned, they're food grade silicone, which is great. And they come in 4 different sizes. So we should be able to get you the right size for your little guys. When I use the syringe nipples, I find them beneficial because if you've got a little guy that's not sucking great, you can kind of help them out a little bit. And once they start drinking really well, you can even hold the plunger back so that they're not sucking back too fast and then obviously aspirating. That's not great. And then we have 2 different scales here at the Breeders' Cupboard, but I do recommend the small scale to start with. It's grams and ounces. It's got like a nice little dish to kind of hold them in, but like Dr. Greer mentioned, they do bounce around, so maybe a fish scale as well. But I love having these little scales. I've had mine for about 10 years, so it's a great little scale to have on hand.
Yeah, I will say the tubes, you should always have one on hand. You never know when you're going to need to tube feed, and it's always better to have something and not use it than, need it in the middle of the night and not be able to run to the store to get it.
$8 and you can have it on hand, right? Yeah, I do love that. And I think everybody should have a little formula on hand as well.
Yeah, and I think we've talked a couple times about the expiry of the formula. And I will say Miranda is excellent at getting back to you, what the expiry is. I think I bought some last year and didn't end up needing it for a litter. So I had a 5-pound, I think they're 5-pound bags. I had a 5-pound bag, and turns out I had a litter of 10 that really needed it. And it's one of those things that I use when I start weaning as well. So it's something perfect to have on hand. All right, so let's jump into some questions. Can you speak on delayed umbilical closure, and is there a way to prevent this?
No, delayed umbilical closure is very likely a genetic disorder, so there really isn't much you can do about it other than eliminate that from your breeding program.
Okay, and then is there any studies on the use of antibiotics in pregnancy affecting the size of puppies or the litter size?
I have not seen any studies on that. I think that's an interesting question. It would be lovely to have information on that.
Does breeder cupboard sell plasma? If not, where would you recommend getting it?
We do not sell plasma, and I have no knowledge as to where we can get it, but I can definitely look into that for you.
Yeah, in the US, we used to be able to get it from Hemapet. Now it's available through Animal Blood Resources in Michigan, but I don't believe that can be shipped across the border.
Most definitely not.
Okay. What size tube do you recommend for golden puppy?
I would use an 8 French for a golden, 5 French for small puppies. Eight is bigger than 5.
Okay. And then foster care also comes in a goat milk formula, correct, Miranda? Is there a difference between the two of them?
With the goat milk base, the foster care GM is the one that's the goat milk base, and it's for puppies and kittens both. Some find that the goat's milk is easier for them to digest. I think it comes down to a preference. I don't believe that the fat content is quite as high in the GM, but it is very, very easy on their tummies.
Okay, perfect. And then can formula in its container be kept for the next litter, or should it be tossed and buy a new one?
As long as it's within its shelf life, it's best before date. It's kept closed, dry, and in a cupboard that's room temperature. It should be fine. I don't recommend freezing it, just because most of these formulas do have probiotics in them.
Okay, and then one last question on the tube size. Is an FR5 small enough for a Chihuahua puppy?
I don't know, Dr. Greer, what's your opinion on that? We do have an FR 3.5 in a red rubber. I don't love the red rubber feeding tubes. I like to see the formula go through, but
yeah, I generally a 5 French is the smallest size that we usually use, but yeah, the 3.5 French is smaller, but the outside diameter is actually not that much smaller. I'd use a 5 because I like the silicone clear tubes that I can see through as well.
Perfect. So back to you, Dr. Greer.
Okay, of course, we want to talk about safety in the whelping box. It's really important that nothing dangerous happens to our little kids. So the temperature needs to be discussed. And of course, pig rails can be useful, especially have some of the larger bitches that are maybe thick-bodied. My farm dogs, my corgis, they're pretty graceful around their puppies, but you get bulldogs, Frenchies, mastiffs, those kinds of dogs. They're not always graceful. So having those pig rails for the puppies to get back away from the bitches can be helpful. Temperature, we've talked about at some length, but it is important to keep in mind that if they are chilled, that they're not going to digest their food. And here again is a summary of what happens with our chilled puppies. So it's important that we have the right temperature. Ken from Puppy Warmer reminds us that the room is part of the system for our incubators. So our room temperature should not exceed 75 degrees, and humidity should be around 55% plus or minus 10%. So that gives you some ranges to work within. Why don't I use heat lamps? I'm not a fan. My personal family, we had a near disaster in our barn when my daughter had 4-H calves, and there was a heat lamp on one of those. Medusa's little calf hutch made out of fiberglass melted down. So instead of it being 4 foot tall, it ended up about 8 inches tall. Fortunately, it happened on a Friday afternoon when our neighbors were home and ran over and knocked on our door. So we prevented the entire barn from going down. I've had clients lose garages, lose houses over heat lamps. So I'm just not a fan. I worry that the bitches are going to overheat, that they're not going to stay with their puppies. They're uncomfortable. They get up, they play, they dehydrate, the puppies dehydrate. So I'm a fan of heating with that gentle heat from underneath with a whelping box.
I think that was one of the most important things. I think kind of the whole idea of this, of advancing what we know about whelping. We saw that in one of your 2021 webinars that you did for us. And my mom used to use heat lamps every litter. And after she saw that, she was like, okay, no more. Dr. Greer says we need to use from underneath. And I'm like, oh yeah. And just finally this year, she finally let me throw them out. So we no longer use heat lamps and they are gone from our house.
So I put this little puppy room temperature together. Oh, sorry guys, it's loud. So the difference between the surface temperature and obviously the ambient room temperature in your whelping room, and needs to, or it can change as they get older. For the first 2 weeks, it's super important. And then as they hit that 3-week mark, you're not as touchy. So yeah, you guys can keep that on hand and use some good thermometers to keep track of that.
Right. So basically their rectal temperature goes up about 1 degree a week, a half to 1 degree a week. And at the same time, you're dropping your room temperature by 2 to 5 degrees a week. So as one's going up, the other's going down as the puppies are able to regulate their own body temperature.
So I wanted to talk a little bit about the Pet Tech Whelping boxes. They are made in Canada, and I don't think very many of us know about these whelping boxes. You know, everybody's ordering from the US, which is great, but these Pet Tech whelping boxes are made here in Canada, and they're made with food grade plastic, so there's no off-gassing, they're not toxic. What I like the best about them is they have these great trays, so the entire box is kind of contained, so your floors are safe, you're good to go. They're super convertible. You can add weaning pens, you can double box, they have your roll bars in them. And they just offered now for your weaning pens, you can get slats so the puppies can see out, you can see in. There's doors between the weaning pen and the whelping box. You know, when you're weaning, you can lock puppies in, lock them out. And they're great. I love them. And best that they're Canadian. That's even better, in my opinion. And then these little tiny room thermometers. I just got these in and I absolutely love them. They're like tiny, guys, little. And I just set them right on on my vet bed in my whelping box. And that told me exactly what temperature my puppies were at. I have in-floor heat in my puppy room. So that helped me know that they're not too warm. It also has a humidity control on there as well. But they have a little sticky on them. You can stick them on the wall of your whelping box as well. So they're great. And then the vet bed, if you haven't tried it, you should. My puppies were up and walking way quicker. They stay warm because it has a little bit of like a thermal to it. You can get them in many different sizes. Pet Tech has this really cute white with blue and yellow paw prints. I don't have it in right now, but it's unique to Pet Tech and it's super cute. And I love the white. It doesn't stain. You can wash it over and over and over again. And yeah, it's just, I found that my moms didn't dig it up as much either. So I always worry when they're digging, that post-whelp dig, that they're going to bury their puppies in blankets. And I found that this just kept my puppies way safer.
I also find with the vet bed and those whelping boxes is you can kind of stick it under because they come with a tray, you can kind of put the box under and it like snaps them in, especially for those moms that really like to dig. And those boxes are so easy to wipe down. We've had many different kinds of whelping boxes and we've been using the Pet Tech for I think 2 years now. They're just so easy to clean because it's such a smooth surface.
And like setup is 5 minutes, right? Once you know what you're doing.
Oh yeah.
And when you take them down, all the pieces fit right into the trays. So you can just slide them under a spare bed or wherever. They're really awesome. I think they're best kept secret.
Right. So we've got a couple questions in here. What do you recommend for sterilizing cleaning of feeding tubes and how often should they be replaced?
I recommend boiling water, but Dr. Greer, do you have an opinion on that?
I just use soapy water and let them dry, air dry. They also have those bags, at least we do here, that you can put them in the microwave, like for children, like when you sterilize their bottles and nipples. It's a microwave bag, so you put the bottles in this bag and seal it and put it in the microwave, and that sterilizes it. So there's a couple ways to do it. And I replace them when they get stiff or discolored or you can't get them clean anymore. But as soon as I'm done feeding, I just rinse them out with soapy water so that milk doesn't cake up in there and leave a residue. You can't really put a brush into them because they're so tiny, so you have to keep them clean.
Oh, that's brilliant. I never thought to use that steamer bag.
Mm-hmm.
And then cleaning between, if you're tube feeding an entire litter, do you clean between puppies? Use the same tube?
Mm-hmm.
All right.
Yeah, they're all swapping spit when they nurse, so I figured it's all pretty much the same, unless I have a sick puppy. If I have a sick puppy, I'm going to feed it last, and then I'll want to make sure that I handle that differently.
All right. What tools do you have to heat underneath? I was unaware of the heat lamps were so dangerous. My female is due any day, and I have her set up with a heat lamp, but may go out and grab a different tool.
So T.E. Scott used to make the whelping nest. There are other companies that make them now, but if you Google search T.E. Scott whelping nest, it'll bring up whatever's available. And I'm sure that there's somebody in Canada. I know there's several companies in the US that make them. They plug in to the electricity, or if you have the need for propane heat or some other heat source, you can use that. And then it's got a rheostat on it, so you can start that temperature at 90 to 95 degrees or 39 degrees at your the temperature, and then slowly drop it as the puppies get older, and you can lower the temperature. It allows you to regulate that.
All right. And then, Kayla, all the things you see on the slide can be purchased at the breeder's cupboard. All right. So back over to you, Dr. Greer.
So weaning is our next and most exciting part. We were talking about this before we started. Weaning is always a relief because you feel like the puppy's eyes are open, they're up moving around, they're taking in nourishment on their own, they feel a lot more independent, you feel a lot more stable, that you don't have one foot out on a banana peel, that you're always afraid that something's going to go wrong. But it also is the start of the time that mom no longer cleans up after them. So we go from puppies that are really tidy and clean and neat in their little box to this event where you have to start doing laundry 47 times a day. So there's several steps to this. Of course, water needs to be the first thing. And I've actually had people think that they didn't need to give water to their puppies. I got a phone call a number of years ago from a client who called and said, my sister has a dog and I think she has mastitis. And I said, well, what makes you think that? And she said, well, she won't lay down for the puppies anymore. And I said, well, what do you have? And she said, it's a lab. And I said, well, how many puppies are there? She said 12. I said, well, how old are they? She said 6 weeks. And I said, what are you feeding them? And she said, feeding them? And I went, yeah, feeding them. She said, oh, we're not feeding them. And I said, well, what about the water that you've given them? And she said, water. And I went, oh no. So first thing, by the time they're 2.5 to 3.5 weeks old, is to start introducing water. I use a heavy dish that's shallow so that a puppy can't fall into it and get into trouble. I've had puppies fall into water buckets. That's a bad thing. The chicken water that's here in the picture works really well too, especially for outside once they're old enough to go outdoors. That keeps them from having debris in their water bowl. And the nice thing about that is that they have access to water without it becoming a swimming pool. And then I love the Lixit bottle as well. Again, you can buy these from the farm stores. You can get them on Amazon. You can get them a lot of places. And I start my puppies as soon as they have a bowl of water. I also introduce the Lixit bottle, and that gives access to the puppies to have water all the time without them taking a bath or swimming in it. You can put chicken baby food or something, some canned dog food, something to flavor the tip of the bottle. And you'd be surprised how quickly puppies catch on to this. So it's a very handy way to make sure that they always have a clean water source that's safe for them to be around. As soon as they get to be a little bit older, you can start a gruel. You can start it on a really shallow plate. This is a litter of puppies that mother had mastitis. And it's a little jerky here. I'm sorry for the quality of the video, but these are collie puppies. Mom had mastitis and we needed to get them started on some kind of solid food. So they're 12 days old. Their eyes aren't even open yet. Not recommended to wean that early unless you have a crisis. Typically, we're going to say 3 to 5 weeks is when we want to start weaning our puppies. My corgi puppies, by 3 weeks, the bitches are like, done with you, go eat out of a bowl. My farm dog puppies, by 7 weeks, they're still saying, oh, honey, you can just come over and nurse anytime you want. So every breed is a little bit different. Every litter is a little bit different. So you can't always say exactly the same thing, but this is where you want to get your canned puppy food out and start getting them on some solid food. As soon as you've got them really eating that effectively, then we can start moving them onto other food. I like to continue to soften the food until the puppies are able to chew their food really well. I've had a few puppies choke on kibble, so I'm really conservative about the age at which I stop softening the food. My husband would stop much sooner than I would. So we always have a discussion about that with every litter. And then we've got, of course, the probiotics that we want to get started. This is labeled for puppies 8 weeks and older. Because we want to make sure that the GI tract is populated with the correct bacteria. Revival, we didn't mention this earlier, but Revival has a nurture Flora product now. That's a probiotic that can be started as soon as the puppies are born. You just put a little dab in their mouth. But by the time they get to be 8 weeks old, that's not an effective product anymore. We want to make sure that they're on something like the Flora to get the GI bacteria populated correctly.
So I have a few products that are my favorites for weaning time. The first one's the Weanafida. Those come out of the UK and I love them. They've got a lovely little handle on them. They're all one-piece plastic with little metal bowls. They come in 3 different sizes. The micro is very tiny with 3 little tiny bowls for your toy breeds, and then the mini 6 and then the maxi 6. So what I love the most about these is each puppy gets their own little bowl. It kind of segregates them when they eat. You make sure everybody's getting the right amount. Very rarely do they crawl over. My puppies figure it out really quickly that this is their spot. They eat at their own little bowl. I find it helps with that kind of panicked competing for food that leads to resource guarding when they're older. So I really love them. You can throw the bowls in the dishwasher, rinse them out. We have those at the breeder's cupboard. And then Pet Tech came out with a puppy feeder as well. It's made out of that same food grade plastic, which is wonderful. And they're a little easier to store than the Weanafida because they all come apart and store flat. So if space is an issue for you, this is a great option. And they come in 2 different sizes as well. They come in a 4 and a 6. So that makes it a good option too. If you have smaller litters, then you don't have this big 6 place. Though I do know some people, if you've got 5 puppies and they've got a 6, then they put some water in the extra bowl. And then the Pseudocol recovery suits are wonderful for weaning. If your mom has mastitis and she's on antibiotics and can't nurse anymore and you have to do that quick wean, she can still be with her puppies and they have no access. There's no getting through those suits. My puppies have tried. They're great. They come in a ton of different sizes and colors. Pink camo is my favorite, but they come in blue and black as well. And they tiny little ones to great big, Great Dane size. So they're another one to have on hand. You can use them instead of a cone as well after surgery and whatnot. So
I will say my Weanafeeds have taken quite a beating over the years, and they're still good as new.
They last forever.
I know.
I know.
I find it slows them down too. They like that rush to get to the food, but also, they focus on their own meal.
My Basset puppies are all about the food, right? So
I
love Weanafeeds.
Well, and I find when you use one of those saucers, they almost do like they're eating, but they're moving as they're eating to try to get more away from someone else.
There's always one fat one right in the middle of it. It's like, this is mine.
And then we've got a question on gruel. So what's your gruel recipe? I had one singleton in my current that really struggled with. So I don't know if that's what you do or how you make it.
Sure. So if you have a puppy that's reluctant to start on the feeding, adding the formula like the foster care to the puppy food can really help to make a flavor that the puppies like better. I generally will do that. I'll add the probiotic. I might add a little baby oatmeal cereal if I have diarrhea. I might add a little bit of yogurt if I feel like I need to flavor it or make it better. But generally, 95% of the diet is just made up of the puppy food. So it should be a pretty easy transition for most puppies, unless mom is spoiling the puppy rotten. You might have that with a singleton.
I get asked often if they should, if they buy a 1 pound of formula and they haven't used it to supplement puppies, should they use it for weaning? What are your thoughts on that?
I think it's a great way to transition them so that they still get the nutrients that they need and it flavors it more like milk. So you slowly increase the amount of puppy food and slowly decrease the amount of formula so that you make a transition instead of just one day you say, here's solid food. Good luck.
Yeah, I found when I started, we have to typically supplement our puppies because our girls have 12, 13, 14, 15 puppies. And I found that was kind of the easiest way to transition our puppies. I would grind up our kibble, like right when I start, I grind it up to like a really powdery, and then I add the formula and I mix that up. And I find I use less water than just soaking it. And I saw from that we got a lot less diarrhea when we were transitioning puppies to weaning, which kind of ties into the next question we have of why would I be having such loose stool during weaning time with soaking the food and then moving them to dry kibble using puppy salmon?
Well, that's also the age that you're going to start having parasite migration if the puppies have roundworms or hookworms. So you want to make sure your deworming protocol is adequate, and there's really not enough time to go into detail on deworming. That's another topic that we've covered before in the Purina webinars.
All right. And then do you recommend adding goat milk to gruel? And if so, for how long?
No, if I've got the weaning formula and the puppy food and the foster care, that's what I'm going to use.
All right. So if we go on to the next slide.
So here's my shopping list for what I'm going to pick up at the store or have around the house: towels, blankets, those kinds of things. Clearly, they don't sell ice cream and bratwurst at Breeders' Cupboard. You're on your own for that. But we do have a really nice shopping list here for what Miranda carries. And I think
You
we've
guys
gone
are
over
always, go
almost
ahead.
everything. Yeah, I think we've gone over almost everything on here.
Yeah. If you're new to breeding and you need some help figuring out what you need, you can always give us a call. Connie and I are happy to help you guys figure out the must-haves to get you through.
And then hopefully you have a great relationship with your veterinary clinic, because when you need some of these prescription medications, then you've got access. Some of these, the silver sulfadiazine and Manuka honey, can be available online. But there are definitely products here that you're going to need to get from your veterinarian. So keep your veterinary clinic happy. Keep your vet receptionists and your vet techs happy. Take them pizza, take them cookies, take them things that make them happy and make them want to work with you as a breeder. It's always easier to grease the wheels than it is to fight the system. So you're going to find out, if you haven't had a litter or haven't had one for a while, that you need to take care of yourself as well, because sometimes this can be exhausting, being up night after night after night feeding babies. So make sure you take care of yourself, or you're not going to be able to take care of your babies. These are the two books that I've written. One is Pandemic Puppy. I don't let anybody buy a puppy from me until they've read this. And my publisher will sell quantities of this book so that you can provide them to every puppy buyer that you get. It goes through the new vaccinations, new spay and neuter, new heartworm, flea, and tick meds. So it's very up to date and current. It goes through about half of its behavior, like housebreaking and crate training, and the other half is medical. So there's some important things in here. And then, of course, the Canine Reproduction and Neonatology book, which many of you already have and are familiar with, for all the details of breeding stock selection, breeding your female, pregnancy, whelping, lactation, neonatal care, and your stud dog care.
All right. So as the sponsor of today's panel, I just wanted to take a moment to tell you a bit more about ProPlan Nutrition and the Pro Club program for breeders. ProPlan has a wide lineup of veterinary recommended research-backed dog and puppy food formulas that are highly digestible, including real meat, fish, or poultry as the #1 ingredient, and have a taste dogs love. Puppy food formulas include sensitive skin and stomach for breed sizes and sport. I've personally been feeding my dogs the sport line for all stages of reproduction for many years with great success. Next slide, please. We also have a lineup of canine supplements, but I wanted to highlight Fortiflora. It's the #1 recommended probiotic brand by veterinarians. Fortiflora can help with intestinal balance during puppy go home, environmental changes, when taking antibiotics, travel, and other stressors. Next slide. So if you're interested in trying ProPlan, the Pro Club loyalty program for breeders offers great benefit and is the #1 choice of Canadian dog breeders. You get a $10 credit on every large bag of ProPlan or box of Fortiflora with our new online rebates. So for those of you that were familiar with our old mail-in rebate system, there's no more of that. You don't have to mail to us. You can do it right online. We have delivery to select regions for large volume orders, and we have really great puppy kits. Next slide, please. All right, so the puppy kits shown here, and they include a free box of Fortiflora probiotic for each new owner, a coupon for a free small bag of ProPlan puppy food, not a full bag, not a sample size. The coupons for 3 free cans of ProPlan puppy wet, $10 off the next bag of ProPlan, Plus, when you order your kits, you as the breeder will also get a box of Fortiflora for yourself. To learn more, contact us or sign up online. Please visit www.purina.ca/ProClub. And if you opted in to hear from a ProPlan breeder representative when signing up for this panel, I'll be following up with you in the next couple of days, so look out for that email. Now I'll turn it over to Miranda to tell us a bit more about the Breeders' Cupboard. Personally shop there. In fact, I just placed an order this morning. Shh, don't tell my mom how much I spent because she is on here. So I definitely recommend that you check that out. And I will say she is super speedy with her times because I placed it this morning and I already got my shipping notice. So thank you,
I,
Miranda, for fueling
I
my.
shipped it I shipped it myself this morning. Thank you so much, Sarah. Those puppy packs are awesome. As a breeder, I would love to get those puppy packs to send my babies home with. So the Breeders' Cupboard, I just wanted to quickly outline that we carry an array of products. We're exclusive distributor for the Breeder's Edge products from Revival, Animal Health, and Doc Roy's. Very exciting to have those on board. And for shipping, as Sarah mentioned, our shipping policy is to ship out same day if the order comes in between before noon that day, because we know as breeders, a lot of the times it's imminent. You need it right away. So if you do have an order you need even quicker, just give us a call. We're always happy to help. And as a thank you for being here on this webinar, 10% off your next order. Just use that puppy10 promo code and you'll save on site-wide. So that's exciting. And I'm really appreciative for Dr. Greer and Pro Club for having us.
So Revival has our Learning Center, which I've mentioned before. This is the QR code to get there. So we have 400 articles, videos, all kinds of information, webinars on there. So it's a great resource for you. And I want to thank everybody for hanging in there tonight. It was a little longer than we expected. We kind of figured about an hour plus some questions, so we're pretty close. So thanks for hanging in there. This is one of my puppies. As you can see, they're wonderful little naughty puppies. So thanks tonight for everybody. I really appreciate Breeders' Cupboard and ProPlan for their support. And we just have a lot of great resources for you. So thanks for being here, Miranda.
Thank you. It's been great.
All right. I think I'm going to try this. There's no launch button, but we have, if you have any ideas about a future webinar, I'm not sure if this is showing up, but if you have one, please put it in the chat. We will be checking. We always like to, find out what breeders information are looking for, especially when we have such knowledgeable people willing to speak for us.
Yeah, we want to make sure we address your questions and your needs. So please make sure that you let us know what we can do to be the most effective resource for you. So thank you.
And if you guys want to keep in the know of what's going on at the Breeders' Cupboard, new products and whatnot, I forgot to mention, definitely follow us on Facebook or join our email list. We send out updates, so then you know about things like this.
All right. Well, thanks everybody for being here tonight.
Bye, everybody.